so my name is Angel Algarin. I'm a T32 postdoctoral fellow at the University of California in San Diego. And today I'm going to be talking about my project in examining geographical differences in the HIV care cascade among men who have sex with men in Mexico. You can go to the next slide. So a little bit of introduction. In 2018, there was an estimated 230,000 people living with HIV in Mexico. And of those, 79% knew their status, 72% of those were on antiretroviral therapy, and 55% were virally suppressed. So in an effort to reach the UNAIDS 90-90-90 goal, it remains important to examine barriers to its achievement. So examining regional differences can shed light on intervention planning tailored to regional, historical, social, and economic contexts. Next slide. So again, the aim of this project was to describe those regional differences in the HIV care cascade among men who have sex with men in Mexico. Next slide. So our methods, we use data from the S. Entre Hombres study, which used self-reported data from 15,889 men who have sex with men living in Mexico. So the study design is a little bit similar to the American Men's Internet Survey, AMIS, or if you can picture maybe a completely online NHBS, that can kind of give you a bit of an anchoring point to understand how we collected our data. So we recruited online through social networking applications such as Grindr and Facebook. We also used Mexico-specific popular websites among men who have sex with men to be able to recruit our sample. The timeline that we recruited was between May and June of 2017. And to be eligible to participate, participants had to be cisgender male, 18 years or older, and have had a history of anal or oral sex with another man, and living in Mexico. Next slide. Next slide. Thank you. So below you can see our regional stratification. And then this was based on where people reported that they lived. So you can see that we had 6 different regions. And on the left-hand side, you can see some of the different cities that fell within these regions to give you a little bit of context of the types of cities that are in these regions. Next slide. Next slide. So for our HIV care cascade and related variables, for those who are HIV negative, or unknown, we were interested if they've ever tested in the past, and then testing within the past year. And then among the participants that were living with HIV, we were interested if they received HIV counseling at diagnosis, they were linked to care within a month of being diagnosed, they received lab results within a month of linkage to care, they received access to art within a month of receiving those lab results, and then whether they were currently on antiretroviral therapy or not. Next slide. So for analysis, we used descriptive statistics and chi-square tests in SAS, and to be able to create the lovely graphics you see on the screen, we used ArcGIS. Next slide. So it's a little bit disoriented on here, but a bit of about the demographics. The majority of our sample was aged 18 to 29, and the majority had greater than or equal to a bachelor's degree. Next slide. So, sorry, some of the information is missing. I think it may have changed when on your computer, but For each of the different regions, you can see the sample size that we had of men who have sex with men from each region. And then the larger N that is underneath the bolded sample size is the total population. So you can kind of see that the sample size corresponds in a way with the total population. And the majority of our participants came from the city of Mexico, which was that center region, which was kind of expected. And the smallest amount came from that northwest region, which is in green. Next slide. So for our HIV negative and unknown participants, we had 13,597 of those participants, of which only 8,827 had ever tested for HIV, and 5,617 had tested for HIV in the past 12 months. And this was significantly different by geographic region. Next slide. Where the city of Mexico had the best outcomes as it comes to HIV testing among those who were HIV negative and unknown, and the Centro region had the worst outcomes. Next slide. And those for our HIV positive participants, we had 1,650 of those. And we saw significant geographical differences in the number that received their lab results within 1 month of linkage to care, and that accessed ART within 1 month of receiving their lab results. And then also for those that are currently on antiretroviral therapy. Next slide. And as you can see, the success of the HIV care cascade by region varies, where the Northeast region had the lowest proportion of those who identified as HIV positive, and the highest number that were accessing ART within a timely fashion. And that even though the highest proportion of people living with HIV were in the city of Mexico, they had the highest percentage of reaching labs in a timely fashion, and also currently being on ART. We also continue to see Centro is lagging, the region of Centro is lagging in care cascade outcomes as it relates to accessing antiretroviral therapy in a timely fashion, and those who are living with HIV currently being on ART. Next slide. So this is the first study to examine regional differences in the HIV care cascade among men who have sex with men. As it relates to the UNAIDS goal of 90-90-90, we're not yet close. There were 31.3% that still have an unknown HIV status, and 87.7% of the sample are currently on ART, not that 90% goal. So among our HIV negative participants, despite testing recommendations, 43.1% of the HIV negative and unknown sample received an HIV test in the past 12 months, with the lowest being in the Central region and the highest being in that city of Mexico region. This could be due to lower resources, increased stigma, and accessibility issues that could be driving these regional disparities. So for our HIV positive participants, for the HIV labs that they received within 1 month of linkage to care, overall only 42.4% were able to achieve this, where the lowest was in that Northeast region, and then the highest was in the city of Mexico. This could be due to a fragmented health system, lab processing protocols, and lower resources. Next slide. So some recommendations for future endeavors. We need to continue that surveillance that can allow researchers to identify trends. We also should be re-examining the resource distribution. So resources for HIV should be distributed in a more targeted way based on what we're seeing and regional differences. And also policies surrounding lab processing, health systems, communication, clinic accessibility, and stigma are all continue to be necessary in addressing HIV disparities in Mexico. Next slide. And that's all. Thank you so much.
All right. Well, thank you very much, Angel. And thank you for keeping up with time. I think we have, based on your talk, I think we have about 5 minutes for questions. So I'm going to be monitoring the chat. And I know that our discussant, Dr. Stoneholm, I think has a question already to get us started. And then I'll queue up the question from, actually, let's go with Dr. Shoptaw. So he had a question. Can you talk about migration and HIV outcomes? Are these men moving back and forth with US? And has migration changed over the past 4 years among MSM in Mexico? So that's the first question.
Thank you so much for your question, Dr. Shopta. So we have not yet looked at migration patterns with men who have sex with men coming to the United States, but I think this is actually a very important topic, particularly among men who have sex with men that are living in that northeast and northwest region that do border the United States, versus the men who have sex with men that are living in that southeast region or are more central in Mexico. So we have not yet looked at migration patterns and how that has affected those HIV care outcomes among our participants in those regions. But it's a good future research question.
Great. Eric, did you want to ask your question?
Yeah, I just was curious about the regional differences that you sort of picked up on, and what would be the next steps in this work for you? How might you address those differences moving forward?
Yeah, so the next steps so I think this has large policy implications. We actually are working with one of the directors at one of the largest health insurances of Mexico, which is IMSS. And this has large policy implications, in particular for labs. So a little bit of background is that labs and the way that they fund labs is a little bit different than how they do here. Well, a lot different than how they do here in the United States, but they've been having some issues in funding labs. And that may be a reason why we're seeing such a high lab uptake of people living with, or timely lab uptake of people living with HIV in the central region, because they have a lot more resources and a lot more labs for them to be able to process those types of samples, whereas like the Northeast region really doesn't have that many. So I think it's all about policy and being able to direct funding to the sources that need it to be able to address the HIV epidemic in Mexico.
Great. Thank you for that.
Thanks for your question.